Yes, we can hear you loud and clear.
Right, so my name is Joseph Opoku. I'm a registered public health nurse. I work at Geist Municipal Health Directorate in one of their chief zones in Accra. Happy to meet everybody here. Thank you so much.
Thank you too for joining, Joseph Opoku. It's always a pleasure to have you. That skinny nutritionist, you are late, but welcome. Okay, so Mr. Anaman, let's hear from you.
Yeah, thank you very much, Mr. Sarkodie. Yeah, I am Stephen Anaman. I'm a man, and then I live in Accra. Thank you very much, and happy to meet you all.
Thank you too. It's good to have you here for the very first time. In fact, you will sing before you go. Yes, for the first time, and they give us some a cappella before we end the show. So, okay, so let's hear from our guest, our lady guest for today. Reggie, are you with us? Can you hear us? Mrs. Asise, can you hear us? Okay. Zanu, can you hear us? Zanu? Okay, so when they come, we will introduce them to our audience. So now let's start with the question that inspired tonight's discussion. Why do so many men delay seeking health care? I mean, even when they know that something is wrong. Let me ask what's the name? Joseph, please take this question for us if you can help us um, understand why men delay seeking healthcare. As a public health nurse, you can also share some experience you've encountered at the facility and all on the field. You can also share some of these with us. And this is an interactive conversation. Please drop your comments, your questions, everything you want to ask. Please drop them in the comment section, and we will ask our experts for you. And also, you can request to join the live if you also want to add your voice to the discussion, and we will add you to it. But Joseph, please help us. Why do so many men? I say so many men because yes, a lot of men, including myself, healthcare is not really our thing. Yes, if you can touch on that question for us.
All right, good. Hey, Anna, Omutminka. Hello, Omutminka.
Yes, yes, someone
Can you
can.
hear me?
Yes, we can hear you.
So, good evening once again. Okay, so when you say why do men generally delay in seeking health care, it doesn't apply to all men. In this case, you have to apply the social determinants of health. A man in Europe has been educated that preventive health is very, very important. So they don't wait to fall sick before they go to hospital. When you come down global south, Asia, Africa, and maybe some of the African islands around the globe, the black man, bibini bɛka sɛ bɛrima na anum aduru ayɛ nwono no. And if a man lies going to the hospital for checkup, question can be like somebody can throw a funny question. Ade wokɔyɛ checkup bebrebe, ade wonyim anaa, woyɛ ɔbaa. Those things mostly come in. Na bɛrima nso na nsɔre ana woyɛ checkup. Ongye hu ndi sɛ ɔyɛ bɛrima anaa.
I know, right?
You see those things. Aha. Na bɛrima na wopɛ hospital kɔ saa, na ade woyɛ sickle cell ni anaa. So these social determinants of health plays a very major role. Your educational background, somebody staying at East Legon or Transaco, or your friend is saying, Kumasi Diamond Hills has a doctor who comes home every day to check up on them. Some have physicians, some have signed on onto health insurance schemes where they are supposed to go for preventive health services at least quarterly in a year. But when you come to Hiamadwinjin, when you come to Kwabenya where I'm staying, when drivers are sitting down around their destiny now, you go there and they'll be like, hey, madam, call hospital at you, call hospital. Ah, madam, who are they? I'm sorry, I'm no me kama mitimi ne me yere kura hyia ma homache ansa me be adwuma nti be ma de oko hospital. So it has a very diverse factors, and those are the reasons why I explained to you the educational background, the geographical background, and even some cultural backgrounds a role in why men delays in seeking help. Thank you very much.
Thank you too. Thank you so much. Anaman, can you also add your voice to this?
Yeah, thank you very much, Mr. Sarkodie, and then congratulations for this particular topic. In fact, mental health is delicate, and then mental health is not only a personal issue, but also maybe a family, community, and a national development issue.
Yeah.
So in Ghana, many men, face preventable health challenges, and for that matter, there is the need to actually look into men health. Yes, why men, delaying seeking healthcare? I mean, statistics has even shown that when you go to some of the, not even some, most of the health facilities, or let's say all health facilities, and then you pick their OPD attendance, inpatient attendance, or whatever. I mean, the records, you can see that female actually come there. I don't want to go into this maternal whatever, as in like the antenatal, and then for them, but let's stick to the OPD, and then where men and then women can visit. You can see that women actually visit more than men. As my brother earlier said, social determinant of health actually play a very key role here. And some people even within the villages have access to the CHIPS compound to go check their BPs and those things. And then, but somebody living in Accra, especially the East Legon that he even mentioned, will go to work and then return very late and even eat this kind of junk food because this person doesn't even have access to good food, or let's say healthy food, because of the kind of work the person is doing, and then also the time of at the time the person even closes from work and those things. Let me come to the cultural side. Yes, in Ghana, many men delay in seeking care. Yes, that is because even my boy here, I shouted on him, and then he wanted to cry. I said, "Hey, boy, don't cry. You're a big boy now. Men don't cry," and those things. He's even looking at my face. Yes, men don't cry, then those things. But a girl, sometimes you even pamper the girl. Oh, women soon, then those things. So men are actually trained, especially within our Ghanaian culture. Men are actually trained to be strong, and sometimes our wife will even say something instead of us to, say that, "Oh, wife, what you said, I don't like it," or whatever. Somebody will say, "Oh, men actually make home." So in this, you have to actually swallow all whatever that you have to pour out for you to be free. And by the time you realize, all those things will be eating you up. Others who fear to be diagnosed with serious illness. As my brother earlier said, instead of you to go be diagnosed and be treated for a simple malaria, a man will sit down and then go and buy a lot of, and the person will not even test for the malaria to be diagnosed before even going. Maybe it's not malaria, maybe it is not this, and the person will just go and then they have a term called it's a self medication or something like. So by the time you realize, the disease will be the disease will progress into the serious state, and then so when you go to the hospitals, you even see that men actually come to the hospital with this kind of serious illness, unlike women. So unfortunately, this often leads to late diagnosis and then more complicated health conditions. So men are actually trained to be strong, and that our strength that this our parents or our guardians actually confer on us sometimes lead to all these things. So this is a little that I can actually speak, or let's say add to what my brother said. Thank you very much.
Thank you too. Thank you so much. Jane, Creative, welcome to our live. Um, is it Kokra? Yes, you're also welcome. And uh, in Kessie, you also anyway. So you're all welcome. Welcome to our life, and don't forget to share so that other people can join and benefit from this conversation. Tonight, we are talking about men, our health care in commemoration of Men Health Week. And they said this week is Men Health Week. So please, let's do our best to try and go for checkup. Nella, you are welcome to our life. You are welcome to our life. Now, let me find out. Oh, yes. You can also drop your comments and questions you want to, if you want some clarification on this topic, you can drop your comments in the comment sections and our guest will talk about it for you. Uh, when we often hear that men are dying younger than women, I mean, it's something that we need to talk about it. Anaman, why do men generally have poorer health seeking behavior compared to women? Yes, I mean, you spoke a little bit about it, but I want you to touch on it a bit more for us after that. Then Joseph too will also touch a little bit on that for us. We know that women are more, or they frequent the hospital more than we, the men. Like you rightly said, it's not like we are not falling sick or anything. Why is it that, um, why is it like that? Anaman, please, if you can help us understand this.
All right, thank you very much. Yes, I think I started touching on it when Joseph actually spoke on it. So men actually wait, especially this kind of excuse me, yeah, especially this kind of our attitude of we being stronger, as in like oh, bema deɛ ɔno na ɔno ma duru a yɛnwo, then those things. So you feel the headache, and so this one I think it is stress because of the work. I won't even go to the hospital. Let me just rest, take water, or let's say take some paracetamol, this kind of self medication. By the time you realize the disease will come in a higher, was in a serious state. And some also, as I was saying, Beman, your friends, I mean, what's the name? I don't know back of So in this case, the breadwinner of the family, a lot of work. So instead of the person, especially your director will call you, Mr. Sarkodie, this thing need to be done and be posted. This is, you have to do it. So you have to spend a lot of time at work. And when you come to the house, you have to also spend some time with the family. So for you to actually go for a medical checkup, for you to even know your health state, in fact, sometimes becomes so difficult. And it comes from our upbringing, our culture. And that is how it is. So when you go to some of the communities, let's say some of the rural communities, the fishing communities and then the farming communities. A woman and then a man will go to the farm, and a woman will actually leave the man in the farm to go to the house and then go and start cooking. Then the man will follow later. Some too at the fishing community, the woman will be in the mokas, or let's say the kitchen, and the man will be on the sea, or let's say on the water to catch some fishes to come. So all these things actually play a role. So for the woman, so for the woman to actually get sick sometimes becomes difficult because the woman has to check check her health, especially when it comes to this ANC. Then when they go, it is also part for them to actually check their health, PNT. So they are always at the health facility within their life. Obenyim, Obewo, the postnatal, let's say this the CWC, still the woman will still be at the health facility. So the woman actually has the chance of getting to the health facility to be checked. But for men, sometimes within our Ghanaian culture, for men to get to the health facility, I mean it's just some one men when they are educated about this a male, is it male involvement or male support or whatever. That is where maybe they even get to the health facility. Ask the health workers themselves who are males. How many times have they even gone to the health facility to even check for their health? They are always, on the field. They are always, oh, your director saying, yeah, because I've made a report. Yeah, I mean, we are going to do this, we are going to do this, we are going to do this. So this is a little that I can say. Thank you.
Thank you very much, Mimi. Mimi Bags, you're welcome. Khalida, Chris, Doreen, Buddy, and Comfort Minka, you are welcome to our live. Don't forget to share so that other people can join this important conversation. Joseph, let me ask you this question. I think how do culture, social expectations, and masculinity influence men health decision? So, Joseph, if you can touch on this for us. I mean, you are the facility, you have um, hands-on experience and all. So, if you can touch on this question for us, we'd be very grateful. Joseph, can you hear me?
Yeah, please ask the question again.
Okay, so um, we want to find out about how culture and social expectations, I mean, can influence men's health decision.
All right, thank you so much. So, culture is the way of life of people in a particular zone or a geographical area. Then the social aspect is how we relate to ourselves. So, with the cultural aspects, I think when it comes to Africa in general, like I said earlier, those in the advanced countries, men, the toxic masculinity is not all that higher there because of issues of gender equality and human rights. Men don't dominate issues there as compared to our black African race here. So let's take, for instance, in a village where, let me even use immunization as an example.
Yeah,
When I was working in one of the villages up north, when it's time for NID and you go into the communities and you enter a house, before you could immunize a child, the woman can tell you that my husband is in the farm. So let him come back before you can immunize my child because I need to take permission from my husband before you immunize my child. The same applies to family planning. If you want to come for a commodity, you have to tell your husband for your husband to approve. It cut across all our preventive health services, ANC. Your husband has to delay you for like 3 months for you to go and see a fetish priest before you are being cleared to come for ANC. So by the time the woman comes, it's already in the second trimester. So when you come here, men dominate over a lot of things. And by your grandpa, I was say Obana friend and son the Aklana hospital. But on one casa day, the man himself has been groomed, has been trained, has been culturally baptized. Say, oh, the Bema de Obeya, Aji Moye Diansa. And it reminds me of recently, I went to a taxi station to go and do BP checking for them. It was only two men that had a normal BP. Only two men. Out of about 23 men we screened, all of them were above the normal BP. Some were elevated, some were even having BP over 200. So what they were telling us was that, oh, but I mean, problem. Me tibi anya me ya me ni so mbiri me makoma mbo periperi. Me sorry anopa me timi ene me yereda. The African mentality Trump kura kan mbiri bi. So for African men, they only they know what they know is sex. Once he is able to satisfy the wife for a bema, but they've forgotten say there are some things that may let you lose your memayeno. That is why when you go into the wards, when you compare the male wards and the female wards, The male ward has some particular strong stench that you cannot stand, but the female ward has some, at least the scent there, the smell there is somehow reasonable and manageable. But the male's ward, we have men having your friend is saying advanced prostate issues. We have men having advanced diabetic complications, which has led them into having gangrenous wounds that are very hard to treat. So, bɛrima bi hu sɛ yareɛ n'ano ayɛ den na yɛ yadeɛ yɛde ne kɔ wuom. A friend of mine passed on recently with a kidney failure. Tomorrow will be 1 week. We don't like going for check because we feel say or Johnson ne poor huro. Oh, me Johnson a poor huro pa when mpanyinfoɔ sɛ Johnson pa kwa ne poor huro. He doesn't know that this there is my friend is saying protein in the urine. So we will say that culturally we have a lot of work to do to at least change a not so good behavior into healthy ones. And I'm glad the government is introducing the free primary health care screening programs. I hope it sustains because those programs can change a lot of narratives. Because I think preventive health care in Ghana here now, Papa Ben, we are just hoping and praying because all the attention have been given to the curative side. And it is this is true health literacy that we can educate our men that adeɛ wei hu adeɛ wei a ɛkyerɛ sɛ biribi sei na aka wodwo nso no ɛhoro bebree wɔ mu a it could mean sɛ wo kidney ne ho aka wowɔ hɔ na wakoma bɔ periperi a it could mean sɛ woyɛ anya akomayareɛ wowɔ hɔ na wo tifa pae ho a hwɛ yie na ebi a na wakɔ akɔnya stroke. All these things they need to know, and the question is, are we even sending the information to them? Because we the nurses may feel say burnout in tea, we are not able to do those things, those tasks. But when we go into the communities, there's a lot of work there. Okada boys, the taxi drivers, the men who goes into your friend and say, you could see a man who went to shop, tailoring shop, much for he will close around 12. But I say, so all these things needs to we need to factor into those things and see so culturally and socially the men has been groomed say bema na no madro bema de obemu say wo yare na abo ato. So this is the few things I could say. That's
Joe, don't you think that let me use the taxi drivers for example, time factor. Like Obeka Kotina station, Honduman or Patu and Mre, onya time crowd, they will call hospital and I say Bisa, obey Juma Monday to Monday. So don't you think that time also and also counting?
all right. The time factor is something we I really remember the day I went there to do this BP screening. Who screening Obina and Shannon Sakra? And I said, "Me car, yeah, mama, me from passengers in court." You see, so we have to at least. That's why community engagement works. If you are working in the community and you engage them well, you mobilize them well, you include them in your programs and your in your programs and your itinerary, they are able to commit to your program. Until we ask them, said, "Abena muye free." Na yɛmmra hɔ no yɛne mo mma mmɛtena ase na yɛnyɛ screening ne mu screening. So the time factor plays a role. Time need to play a role. Okɔ anɔpa paa, people are at the rush hour. They want to take car and leave. Okɔ enyimire nso a, people are at their rush hour. They want to board taxi and go to their various homes. So I think during the noon time, like around 12, 1 thereabout, their job is quite stabilized so that we can take, for them, they're going to the hospital party. I don't know whether there should be a research to come and tell us, say, oh, when we went out, remember, this BBC in Omunko, and Omunyanka, that's saying, even it will be very hard for us to. So let's hope and pray that the free primary health care that the government has brought for us to at least meet the drivers or the community members halfway, could help us to at least unlearn and learn about how men's health is evolving in this country. Thank you.
Thank you. Thank you so much. Chief Tan is also saying that I think the monetary aspect also plays a role. Yes, of course, it plays a role. But now they have no excuse, or you have no excuse, because we have free primary health care. These things, the basic health checkups, they are all free. The basic ones, when you go, they will do it for you for free. So now you have no excuse. Just find time, visit any health facility, and they will take care of you. So yes, Joe, wow, so beams is why what are some of the most common health condition affecting men today? And also, the Anna we ignore. Ebi on say, oh, wait there, no let me just leave it like that. What are some of them? And also the ones that we should take very, very serious. Like when we see the symptoms, na yɛde kɔ hospital na nka sɛ yɛtwɛn na wabɛkɔ anaasɛ biribi saa sɛ wobɛtumi amentions ebi ama yɛahu a. Yes, if you can unmute yourself and talk.
All right, thank you so much. But before we make from crans and so most of the times, almost a bema edrimika ko hospital and a bema ben nurse ni for apomodin issues. So because maybe an efa nimpama gudi ho premature ejaculation, erectile dysfunction. Those human you don't know, but those human you know nkum mema nkum o bema enye adwuma. And I ever say wokɔ sense so asisi anu wagye mu a unmu. Deɛ ɛbɛku ntɛm no high blood pressure and diabetes. Saa nyarewa mmienu wei paa na ɛtumi mmarima no say prostate cancer is a reproductive cancer that affects men, but we don't add it to the leading cause of death among men because yɛhu ne sɛ Africa ha no black man o race no prostate cancer ɛhɔ ɛbɛtumi anya wo. But nneɛma wei mmienu no pɛ very highly preventable: diabetes, hypertension. Some complications na yɛkɔfa kidney failure ɛba mmarima no. Even this their erectile dysfunction any okay, I'm not premature ejaculation into nkyɛn. Erectile dysfunction, when you are diabetic na eduru some advanced stage bi wɔ hɔ a wontumi enya yɛfrɛ no sɛ erection ma ne nyina so sɛnea wopɛ no. Aha, nti saa nyarewa mmienu wei ɛna the leading cause of morbidity and mortality among mmarima. Wotumi sɛ bɛrima wobɛkɔ baabi na stroke akye bɛrima. Mmarima no tanya stroke ofisi a mmarima dɔɔso kyɛn mmaa. Ɔte aseɛ. Ɛna yɛn wellness clinics no mmarima ne mma. Ɛna sɛ wokɔ hypertensive clinics, diabetic clinics na wokɔ akɔhwɛ how things are being run over there. Mmarima no be register ɔmo mma biem, mmaa no na dɔɔso hɔ. So those two diseases no and the highest morbidity and mortality among men because complications no doso oko renal association na omatina e mema no doso chen ma no. But afibia se wunya adaje o kidney function test na hu se o kidney no free normal function level na aba stage 2 a ye kire wo nuane e wo se wudini de empese we ya you will never advance to stage 5 your friend saying dialysis stage no. Nti the two most or the morbidity cases are ekum mema pa saa nyarewa mmienu because na ye kofa stroke ne brain mema no oh high so we adwuma mu no buhwe ye na say oh ha na o si bema bi ko bema o ko jogging e no twa hwe ye. All those things are part bema gina gym hɔ a na ɔban ne calories no tumi twa hwe ewu hɔ because akomayare de no ho agim. So those two cases no any the most leading cause of death among men. That's
Joe, before answer na major no, you mentioned prostate cancer once. I think say so age ben ɛna bɛrima woduru a ɛwɔ sɛ o check your prostate, and how many times within a year do you think is appropriate for us to check?
no. Most of the times we don't have social policies and can be to me enrolling men to say prostate and prostate examinations and yɛmfa health insurance ho woyɛ bɛrima na wonyɛ free mfie 30 years kɔ no a ɛwɔ sɛ wotumi check wo prostate yɛwɔ
Hey.
biribi a friend kobi bɛka biribi
Oh, there because of.
okay yɛwɔ biribi a friend no prostate surface antigen PSA yɛwɔ PSA yɛwɔ sɛ wɔ check wo PSA no yɛwɔ numbers bi a yɛde susu sɛ wɔ antigen levels ne ɛdɔɔso kyɛn some specific numbers ɛnim tirim deɛ but ɛwɔ high a it means that the likelihood of you getting a prostate enlargement ne so and there is difference between prostate enlargement and prostate cancer prostate enlargement na yɛ ana prostate no bɛyɛ kakraka na ɔsɛ yɛde bɛrima yɛde ɛyɛ friends and rubber anaba catheter ɛto bɛrima mu na ɔdwo nso fam with the prostate cancer ne deɛ cancer ne didi ɛsɛɛ prostate na ma wotie anyɛ yie a woyɛ mu nneɛma nyina ɔba abɛsɛɛ no nti there are two different things but wokɔ check wo prostate PSA na prostate surface antigen na yɛsan also screening for cancer nso ɛka ho aha nti wonya duru mfie 30 years kɔ no a you need to be checking all those things na biribiara nkɔ because ɛntaa nkom nkurɔfoɔ saa nti well but once a while in a year wobɛtumi acheck it once a year you can check that's the part.
Joe, yeah, that also, yeah, that was it. So thank you so much. So I'll come back to you, but um, a lot of people are joining. So is it Frankie? Yeah, Frankie, you are welcome. Ax and Ducky, you are welcome. Mrs. Blay, you are welcome to our live, and also Dolly. Is it Dollface? Okay. Eh, Dollface, you are welcome. Elizabeth Akako. Okay, you are Minta. You are also welcome. Yes, you are all welcome to our live. Akosia. Akosia also just joined us. So welcome. This is the Good Life chat room of the Ghana Health Service. We do this every Friday evening, 7 p.m. We choose a topic and discuss about it. But this week is men's health. A mema ho apomuden. So we want to talk about men's health. And I have Joseph Opoku here with me, and I have Mr. Stephen Anaman too here with me to talk about our health, which is the men health. Now, Mr. Anaman, let's talk about something many people don't see all the time, which is mental health. Why is mental health an important issue for men? And also, why do many men struggle to speak up openly about about stress, the stress that they are going through, the depression, the anxiety, the emotional challenges that we go through? I know that Joseph spoke about our culture. We the men, some of these things you say oh bema way, bema way, but why is it so? If you can touch on these for us, Mr. Anaman.
Very much. Yes, you have actually mentioned one, our upbringing, our culture, how we relate to others. And then I earlier on said that, if there are some issues, even with yourself and then let's say your a lady sibling, or let's say your sister, your mom will tell you that, Jai, now, when we are Bema, I don't know, yes, sir. You are even to protect that your sister instead of you actually coming out to even talk about yourself. I mean, to even lay your grievances. So mental health for men is often overlooked among let's say mental is often overlooked among men in Ghana here, and many men are taught to hide their emotions and even endure challenges silently. Sometimes you'll be hungry, especially those days when you were in the SSS, you'll be hungry instead of you to come out, bro. And yet, Charlie. Daddy uncle ye I was on or Garo house socket make a can fan check out. Unless you become so hungry before you even come out to even because they will tell you that you are like, what's less radier. So all those, training that we have actually gone through actually, suppresses man to come out with whatever that is worrying them. So as a result, stress, depression, anxiety may even go unnoticed. There may be an issue. Let's say you and then your wife are taking care of, let's say, your three children. Your wife is even, supporting you, and they have made it like mandatory for a man to take care of their children, but their wife supports. That is how it is in our Ghanaian context. And for that matter, whatever that you have to do to cough out the money to take care of their children, you have to do. You have no excuse. That even breaks in this kind of, what my brother Joe talked about. What the calf is even on the person's arm to check the BP or send a car, yeah, man. Because the person has to bring out money. One of my brothers talk about it, or say the monetary issue is also, yes, as a man, you have to bring out the money and you have no excuse. So in this case, there is nothing to complain about. So whether you are going through a depression, whether you are going through, let's say, some kind of difficulty, if there is an anxiety, you need to endure as a man. Men are born soldiers. Men are born this. Men are born this. And sometimes, if women even try to own up something, they will even tell you that, oh, now we are bear man. Now. I remember you were going to check on some lands, and then you were going through the bush. One of the ladies among us said, hey, so for your Juma de Ampa, mema Juma. Now, we the Nyamia Shiraswama mema. You see, there are some kind of work that comes with what? With stress. And you see, they say, Nyankupon Shiraswama mema. Look at Okada riding, look at driving, look at hardly will you even see a woman riding a motorbike as Okada rider or whatever. So the kind of stress, the kind of, all those jobs that comes with the stress and then eventually comes with what? With mental health issues are done by men. And women are actually, born to be protected. And that is why somebody, I don't want to say it, but let me bring this one. Let me just, somebody said, what actually men benefit from marriage than those things. You marry, you have to take care of a woman, you have to take care of your children. A woman will support. Oniska, it is not by force. In our Ghanaian context, especially the local context, it could be that your wife may even have money, but the worker say, "Oh, Charlie, me krusika kana me de." And there is a saying that me kru de this guy here now me there and those. It means you have to stress, go in and out to bring out the money, and all these
Ɔse
things brings about.
ɔbaa sika yɛ ne dea ba bɛrima sika na yɛde hwɛ fie.
Yeah, exactly. So whatever that you have to do to cough out this kind of money, now you know, or say that you have to do it, bring out the money, and it all brings about the stress, the depression, and all those things that you are talking about. So you must actually create a very safe space where man can speak openly and seek help where needed. But here in Ghana, you go and say, "Oh, are they now? Are they ambo man? Are they way or now?" In my side, and I say, "Now what's on and now this year." I mean, the way they even talk about it, and I mean, you will never be. I mean, you can never come out to speak openly. So you have to create that. And what my brother Joseph said is very key. There is the need, at least, there is the need to engage a community as to how maybe if there is this daddy clubs, if there is this men groups and those things, you engage them so that at least you can be able to, educate them on all those things and even seek help whenever they need. Or else men will always die and leave women. And then that is the reason why sometimes a wife will ask you now, "Oh, net is saying that Ben and we will no." But you can't ask your wife, say, "Oh, no, so no, we net is saying that Ben no bear," because I mean the stress is all over you, and it is accepted that you die early. And for that matter, if something is worrying you, what do you have to? What do you have to say? You don't have to say anything because you are born to do that, especially within our Ghanaian context, where this gender equality is not actually, highlighted or let's say echoed well. But when you go to the advanced countries, though it is there, but then it is streamlined, a bit. But here, Charlie, so all this conditions like the stress, the depressions, the anxieties may go unnoticed if you don't create a safe space for men to speak openly and also seek help. Thank you.
Thank you so much, Mr. Anaman. In fact, you do. Oh. Charlie, man, we have to speak up. Oh. We have to speak up. If not, you die early. The, the depression is high. The anxiety, yeah. And you see, the good news is the service has provision for all this. So if you are feeling anxious or you are depressed about anything, just walk through to any health facility, and they will attend to you. Don't feel shy. Don't, in fact, just walk there, talk to anybody, and all these services will be provided to you. Sally, welcome to our live. Women, you are asking a question. Women are not part today. No, today is just for men. Today is just for men. Okay, Sally, you want to come on and okay, let me accept you and let's.
Nti sɛti ano yɛde kakra nso a anyɛ kakra yɛde bɛkyɛke whatsapp yi sɛ afo pɛ dɛ ɔhijack ma wo hijack kakra walɛhwɛ a
Sally, welcome to our live.
Thank you.
Uh-huh. Is there any contribution for us? Any advice?
Mama Caro said I have only a question to ask. Also, I'm just following. In case I have any question, I'll ask.
Okay. Thank you so much for coming on. So,
By the way, in a form of introduction, I'm Selino Seitutu. I work at Asokwa Municipal Health Directorate as Health Promotion Officer.
oh, welcome, Madam Sally. So, we do this every Friday evening. We pick a topic that we discuss about it. So, next week, for instance, is sickle cell. We'll be talking about sickle cell. So, I mean, welcome. Join us anytime that you are free, and we will engage you. And we need your expertise more. After this, please send me. Let's get in touch in the in the inbox so that we can add you to our
All
activities
right.
to join. Welcome to our
Thank
life.
you.
Um,
Thank you.
baby, welcome. Ohineba, you are also welcome. Miss Adobia and Sir Juma, you're also welcome. Mabel, you're also welcome. Kobe, is it Kobe Brown? Yeah, Colby Frank. Okay, Colby Frank, you're welcome. CA, okay. Okay. C CA, you're welcome. So, RN Doki, yes, you're also welcome. Ask RN Doki. I think you've been on for a while and we appreciate it. So tonight we are talking about men's health. The Our men don't normally go to the health facilities to check up more regularly. So we want to find out why and also provide some basic education for them to talk. Earlier on, we heard Mama Caro talking about awareness and all. Now let's move from awareness to action. Joseph, what routine health checkup should every man be doing regularly, regardless of their age, whether from now they say when you are 18 then you are a man legally you are yes you are a man, so from age 18 to unlimited, what routine checkup should we be doing, and also how often should men check their blood pressure, their sugar, and even overall health status? Joseph, if you can touch on these ones for us.
All right, thank you so much once again, and I welcome all the those who just joined us. Okay, so with the routine medical checkups for a man, it also sometimes your that's why I was using social determinant of health. Your income can determine the labs that you should have. Wohwɛ mmarima a yɛabrabɔ a yɛrebɔ a, ɛbɛrima tena ase memem da anaa kwasi ada ɛbobɔ ntoa mu. ate aseɛ ɛwe nam ɛbobɔ ntuom obi wɔ hɔ koraa ɔpɔn adwuma da biara ɔpɛ biribi kakra yɛ dɛn ɛbobɔ ntuom kakra saa nneɛma no nyinaa ɛyɛ a na ɛwɔ nsunsuasoɔ ɛwɔ yɛn blood pressure no so ɛna afei nso stress no a yɛfa mu da biara no wo girlfriend gye wo yere gye ɛna mɛ sɛ frank sɛ bi a akwadaa ketewa bi so a wastate saa no na ɛkeka ɔno nso so ogye ɛsa pressure no bɛda so bebree nti bp checking ne deɛ it should have been an everyday thing wakɔ adwuma no a wote hɔ no a bi a obiara mmaeɛ no na wame akyekyere wo nsa na wode ahwɛ how your day will go if your bp is too high for that day you need to rest anaa bi a wobɛma o task no bɛmu obi ayɛ secondly so sugar testing no yɛdi banku saa mmerɛ meka sɛ obi bɛpo adwuma obi twi kaa anadwo ɔbɛpo anwummerɛ uber drivers ɔbɛpo anwummerɛ ɔpɔn afe no kɔ akɔdi banku anaa fufuo ɛbɛyɛ dɛ na digestion ateki kayi nti saa nkurɔfoɔ no wɔsɛ nka fasting blood sugar nso ɔmo yɛ so maka biribi about bp checking something like about sugar testing of sugar no kwade sisi saa nneɛma mmienu a meka yi pharmacist ni bi taa yɛ ɛma wo nsɛnna hɔ the fasting blood sugar no ma wo nsɛnna hɔ bi sɛ wabɛn diabetes anaa wommɛn no a wonnidi yɛ na wo check a ɛna wo bp no nso so no wagye wahome no a wo check no nso ɛno nso te sɛn then the third one I will talk about no yɛ liver function test liver yɛbrɛ bo a yɛde ɛda yɛ mu a yɛde yɛ mmarima bebree wewe nneɛma sɛ bɛyɛ a wɔn bɛrima mu bɛyɛ den na wɔn atumi yɛdi agoro wɔ mpa so saa nneɛma no a yɛrewe no ɛne nneɛma no a yɛrefa sɛ ebɛtumi ayɛ adeɛ wɔ mpa mu no ɛwɔ nsunsuansoɔ ɛwɔ yɛn brɛboɔ so nti bɛrima deɛ ɔwɔ hɔ a nkɔsɛ nka afe biara wotumi kyɛke wo liver yɛre nam ɛtena nsa ho ɛnom yɛ cholesterol levels wɔ sɛ yɛkyɛke ɛna adeɛ baako a sɛ yɛankyɛke a yɛbɛhu no ɛbɛyɛ aduru stage 5 a na ɛde yɛkɔ wuo na afei deɛ yɛyɛ posters ɛbɛto online sɛ nkurɔfoɔ mo ayɛ ɛyɛ yɛn kidney function test woyɛ kidney function test no a yɛfrɛ biribi EGFR yɛcalculate no according to your age EGFR no yɛfrɛ no estimated glomerular filtration rate a kyerɛ sɛ nsɔneɛ no a yɛfrɛ no nephrons na ɛwɔ wo kidney nim na ɔmo sɔne ɛfrɛ no sɛ ade fi firi mogya mu no rate at which ɔmotumi sɔne mogya so nipa bi a wɔ sɛ wotumi nya 90 milliliters per something wɔ sɛ na wotumi nya ɛna ɛkyɛ sɛ wo kidney no yɛ adwuma ɛkisa wokɔkyɛke wo kidney na ɛyɛ 90 and above a yɛka sɛ wo kidney no yɛ very healthy sɛ wɔ 89 ɛbɛpem bɛyɛ 70 a asɛ kyerɛ sɛ wo kidney no ahoɔden no aba fam kakra 79 no de kɔ 60 I think saa na metrics ne te a wokɔkyɛke wo kidney na sɛ filtration rate ne nam 15% a na ka sɛ woyɛ akeka kɔ stage 5 na ka sɛ wo kidney no sɛ asɛe ɛna yɛ ana mmarima no bebree yɛntaa nkyɛke nti ɛno koraa de bɛhia paa diabetes ne hypertension ne sunsunsuansoɔ ne yɛ kidney problem no obi yɛde bɛrima bi ato diabetes aduro so anaa yɛde bɛrima bi ato pressure aduro so osuro sɛ ne bɛrima anya adwuma biem nti wagya nnuro no nom wo kidneys bɛtumi agya adwuma yɛ nkisa woyɛ obi a yɛde wato yɛfrɛ ne sɛn diabetes aduro so pressure aduro so na woyɛ bɛrima na wotie me na bi a wagya aduro no nom a bɔ mmɔde asɛ wo kidney no nka bɛkyɛke no bosome mmiɛnsa biara na meyɛhu sɛ baabi a wokeka kɔ no da so gyina nkɔm a naada so ɛkɔ owuo nkwanta nti so saa labs no ho hia meka biribi about prostate surface antigen ɛno deɛ wobɛtumi ayɛ nafe biara once and maybe every 3 years wobɛtumi ayɛ once na wayɛ wo liver wo kidney wo cholesterol because wobɛnom nsa wobɛwe nam wobɛdi indomie ne mmarima kane na nka mmarima ɛnom biribi kakra a banku bi anaa fufuo bi na wɔde na awia na bi a watena dame ase ato na anaa wanante ɛnɛ wobɛdi indomie bi anadwo wi anaa bɛtena Netflix and chill na wayɛ TikTok live anadwo ɛkisa nneɛma no nyinaa no wo cholesterol levels na wo build cholesterol levels no so build a ekosisi ntini nim yɛfrɛ biribi arterial sclerosis wo arteries na ɛdi mogya di afurusane wɔ mu no na emu akɔdɔre saadeɛ na afei deɛ ama o pressure o blood pressure no nso ayɛ dɛn akɔ soro nti wɔ sɛ yɛkyɛke saa de cholesterol deɛ afe bi abɛtumi ayɛ once kidney no bɛtumi ayɛ once liver no bɛtumi ayɛ once prostate met me once, but BP no any a situation check in the cabin kabosumi. Yempreno and Prensa. Now what should be everything about Kuba. But that's
Yes, we had that was it, baby. But before answer na beko no, mami Musa, question way. How do alcohol consumption, omo paying some baby no, and smoking, and also poor diet and physical inactivity affect men? You spoke about poor diet a bit, but if you can wait me out a little bit deeper for us, obi onuma, like you said, at this time afei na afa fufuo esi n'anim a ɔbɛhwɛ football match aba abɛ ɛdi ne nyinaa gu ne mu wei a so na wakɔda. So if you can touch on this in alcohol consumption, smoking and poor diet for us, Eddie Beji.
all right. Thank you so much. With the alcohol, no, I think almost everybody know a requirement to be able to win ya. But with alcohol issue, no credit. I won't even say every bremo have call a advanced country, maybe say Russia, Germany credit him say beer or moon beer pa. Nkronko na atwa ho ahyia no baabi a mema no nsa kyɛn ma mema no pa mema bɔ ntuom nti alcohol consumption no me den kamenya to me de en de kamenya omo fa no occasionally ne nkɛyɛ and omo occasionally no be the weekend o obi so occasionally every day nti any individual no discretion say bi a me bo bi a bottle ba ko minister bottle ba ko da kora but emwa at least weekend obi so be wunim obi so be boabo ne nyina no na weekend no dey assume weekend ne be obo be 7 bottles no si ho onya hwe o enam si ho no worry nti alcohol ne dey kam den keka me nko a ka nipa no onum anka nom kakra bi me nom mmoro say yan say ebi so use bible verse no no mo dey afa so boro omo dey afa so hwe nsan obaka ge so yesi me nom so me mmoro na nso wo nom nti me kwa na me nsanom ne dey and come in name the required latest was obi take it but at least unya say one guy you be na o born kwesi ada aye active aye aha but what's aka bibi apart from alcohol ka bibi
Smoking and a poor diet.
Smoking no and smoking no there was tobacco kanene na nanom omo nom ebua your friend no tobacco seed no tobacco aye no leaves bi or the gu ade bi aye say tokro bi as a straw bi tria so your friend ebua and that was tobacco but omo no ma no omo nya nsunsuaso but ene no ene nyoma na sesa kakra because na no ebua na no omo nom le da bia but so obi hye to a anope wa hye kakra enwuro besa hye anadwo besa hye we sem de me ma ho because marijuana issues no akoye no more of very sensitive to talk about because obi be catch us wa hye we enye ne hwe da obi so be catch us wa hye a na otimi de ye adwuma ne ahoden obi so betu catch us wa hye we na otimi ehu nyoma ni so yie aha but tobacco smoking na no monom omonom in moderation no na enhye da affect because to musa na wanya 90 years na ote sa 34 akonya ye na wa hu sa akonya how do I even say it ye edua na aye ye gigidam sa lazy chair bi na nanom dem no odem no onom sa ebua na make that tobacco no but ene yeah, nyoma over me who was bro farming can like we do things overdose nowadays and no na man nya nsusu aso because na nanom time no oh na wanya be 70 80 years or no mabua until so nya lung cancer that but ene wo shiwi ni bebreba you could get conditions like pulmonary embolism because chronic smoking could lead to you getting clots in your lungs I be ma home ho aye diama because minimum be no shiwi pa very very hard onya pulmonary embolism condition be a moja ebe eda ewo lungs nim ema inflammatory min koma aha ntinka ohye no ye moderation ye untimi kan to be onum wi so nja hye and the oboa but oka tell me say be weekend she ba ko kakra bi na yɛfrɛ no sɛ wɔbɛte wase kakra baasɛ bi a wɔhye ntoatoasoɔ no ɛyɛ a na ɛhu kakra. Mepatwɛ ka poor diet nso meboa.
Mipatron, poor diet.
So with the poor diet issue no, kane na nka ni hɔ saa, kane no na nka yɛfrɛ no sɛn anapa yɛyɛ ha no na bibire mu ha ne yɛnhyɛ da nyɛ tii saa tii anapa na yɛyɛ no yɛnyɛ bi. Anɔpa wo maame ebetumi atoto bɔɔde na ɔde ama wo na ade ahyɛ obotom akɔ sukuu ɛyɛ carbohydrate but wowie a wokɔyɛ adwuma wɔ sukuu mu hɔ ama at least I utilize that energy no ɛwie a wobɛbɛ fie no bi a bɛyɛ 3-4 o'clock no yɛawo fufuo no mu adi mode fufuo no wie a mobɛpie abɔnten akɔdi agorɔ but ɛnɛ nte saa ɛnɛ anɔpa yi obi bɛba abɛyɛ tii na wakye kosua na wayɛ indomie aka ho na wayɛ sausage na wadi wayɛ tii ne saa nneɛma no awie na wadi awie no instead of sɛ nka bi bɛkɔ akɔnantenante ɔde bɛyɛ adwuma no na ɔte hɔ na ne nsa si ne phone so awia fufuo no anka wɔ sɛ nka ɔdi ne ntam no ɔndi ne ntam o ɔbɛdi fufuo no bɛyɛ 7-8 mu hɔ ansa na wabɛhwɛ Netflix but gone are the days ne yɛdi fufuo 4 o'clock anaa 5 na saa mmerɛ no a yɛpie abɔnten kɔdi agorɔ. Yɛn tam kwa ne yɛkɔtetɛ wɔn a wɔapie abɔnten kɔpɛ mmaa no ne yɛn nso yɛtetɛ wɔn ne bi wei ne wei gyina kiosk yɛ akyi yɛnkɔ ne yɛnkɔhwɛ bi we were using those times to burn fat but ɛnɛ no yɛma lights out a adeɛ a onipa bi busa no sɛ ne phone kolo ba lights out a yɛpie abɔnten saa mmerɛ no kwa ne yɛkɔdi agorɔ wɔmmra ne mfifira tew wabɛdware no wada but ɛnɛ nneɛma asesa nti diet no koraa deɛ nnɛ nkurɔfoɔ da one diet so because of complications bi ɔmo fa mu nti ɔda one diet so nti ne diet no akɔyɛ ɔfa carbohydrate kakra na wafa vegetables bebree na wafa ɛnam kakra bi na odi for the whole day ɔndidi bi mu. I know people who are on those friends and diets because ɛdidi mprɛnsa no akɔfa problems abrɛ wɔn because when they eat ɔmo nyɛ aduane na ɔmo adi no so adwuma wobɛdi banku mmiɛnsa no wada wobɛdi banku mmienu no wada daabi ɛwɔ sɛ wode yɛ adwuma because ɛyɛ energy giving food energy nso deɛ wodi a ɛwɔ sɛ ɛba abɔnten wode yɛ adwuma ma calories no bi yɛ den ɛbɛn ne nti wodidi no na wode susudeɛ bi ato ho sɛ aduane no a wodi no ɛho adwuma na woyɛ anaa patwɔ sɛ wote aseɛ.
Mate wase pɛpɛɛpɛ.
Nti dieting no you can either eat once a day, twice a day or 3 times no depending on adwuma a wobɛyɛ wɔ aduane no ho. Meda ase mpatwɛ wo biribi biam ka ho.
Patro no yɛso yɛda ase paa. So
yo.
it's all in moderation. Biribi a ɛbɛyɛ biara no we should do it in moderation. So all too soon. Mr. Anaman, let me ask you this question. Somebody wants to find out like small changes. What simple lifestyle changes can make men? What simple lifestyle changes can men make starting like today? Can you touch on this question for us?
All right, thank you very much. But before that, let me actually add a little to the alcohol and then the smoking. I
Yes.
think with this journey of health, profession, I think I haven't come across any literature that says you shouldn't drink. As Mama Caro, I don't want to use Mama Caro. I can still use Mama Caro. I think yes, that is my brother's should I say social media name. Yes, Mama Caro said alcohol in moderation, kakra, then those things. And then for smoking, he said don't smoke and take alcohol in moderation. But all cannot say be occasionally. Be occasionally. Said all cannot. It be occasionally. Every day. You may take alcohol occasionally every day, and it leads to excessive alcohol consumption. The Yakika, we were talking about what? He was talking about liver functioning tests, LFT, and those things. Yes, it's alcohol there. Oh no, ma. Everything I say, liver, sometimes heart, even the brain, cramponatomy, and the smoking and those things, the lung cancer, the heart disease, the stroke, and the respiratory illnesses that he talked about are also key. And this kind of the xenophobic attack in South Africa, when the South African went to the employers, let's say who have actually, opened businesses and then advocated that they should employ South Africans, their issues were that Monday work. It means on Saturdays, the way they drink the alcohol on Saturdays and Sundays, it affects Monday, attendance to work. So in this case, it affects your workplace issues. And this kind of a family abuse, some people will go and then drink and come back to the house and then attack wives and those things. And let me say that some of the hard girls too, the hard girls, Charlie, some of them also drink a lot, and when they come to yes, they also attack men in a way. So I mean, either ways actually affect family. When your wives drink a lot,
Yeah.
it has an impact on what? On men. And when you as a man, you also drink a lot, it also has what? An impact on your family. So domestic violences and all those things will also happen. And let's look at the road traffic accidents too. We always talk about road traffic accidents and their causes, and most of them are what? Are this kind of alcohol induced reckless driving and those things. Yes. So all those things are also there and also affect work, as I also said. So instead of you, especially in the advanced world where what's the name, work or stipends are paid in hourly wages or whatever, if you don't come to work early Monday because of what hangover, it will affect what? It will affect your income. So all those things are
Yeah.
there. Now let's come to the simple lifestyle that we are talking about. The moderation of what's the name? Eating in moderation, the healthy food, as Mama Caro said. Nowadays, this Indomie, especially Friday night and Saturday night, you see people with beer, Indomie, chinchinga, then those things. They are all not. I don't want to say, but okay, fine. Moderation is fine, but those food has been their kind of diet that they actually take
Yeah.
when going to bed. Indomie at night. So Anke Beya, at least this our those days you say balanced diet. Later on we came to wellness diet. Then later we said adequate diet. Then those things. Food that contain all the food nutrients. So in this case, if you are taking fufu, you know the time that you take your fufu. And that is why, sometimes, our fufu, you go and take it in the afternoon. You come and sit by our computer, you wake up small and go to, hey, Prince, where are you? I want you to do this for me. I will not call you on phone, but I will descend the staircase, come and at least, because the fufu too, I will not drive. I have to walk to the fufu joint, eat, and also walk back. Then, when you come to the office, at least 30 minutes, you get up and then go to somebody's office, or you get up and walk around small. Then, when you come to the house, you come and take your fruits or your vegetable salad. Then you sleep. Then again, our diet has become more of salty, too much. Salt actually gives taste. Sodium chloride actually, the one function of sodium chloride is to draw body fluid to the blood. So when you take in too much salt, I mean, it's the hypertension that you are actually, trying to cause for yourself in this case. So salt are actually for a taste, and for
Yeah.
that matter, you don't have to eat too much of the salt.
Okay.
This afternoon, I have to take too much coconut. I have to take 2 coconut water because it's been a while that I've also taken. So in this case, when you are there, you have to be taking all those things. Then, as a man, you have to what? Also work out. At least you go for a gym, you go for a walk, and that is why some of the whites, or let's say, when you go to the advanced countries, their life expectancies are so high.
Yeah.
You see a 70-year-old woman or a 70-year-old man walking every morning. Every morning, the person has to walk to a railway station,
Mm-hmm.
pick up a station, a train, go to the work, and when the person even gets down from the person has to walk a distance to the office. The person may have a car in the house, but the person actually barely drives the car. The person use the car for, let's say, funerals and then let's say weddings. Then, but when the person is going to it, the person walks. But in Ghana, when you drive, that is where people actually see that yes, when we your guy. And if you are able to also maintain a healthy diet, and you become, let's say, your body actually become a moderate, should I say, you don't, the body hasn't built up. They say, oh, this car. Recently, I started putting on weight, and people in the office started saying, hey, see, I said, why are you fine? I said, Now say a masha say me di anaju because me pon tem no. Me di anaju na mo say my fine. You see our kind of mentality. So in this case, all these things also play a major role
Yeah.
when you want to as a what's the name, as a young person, if you want to grow and grow very well, you have to also
Okay.
take all these things into consideration. Thank you.
Thank you so much, Mr. Anaman. Before you go, your last words. So 10 seconds. Give us your last words.
All right, so thank you very much. So as a man, please try as much as possible to go for checkup. If there is anything bothering you, if your wife is worrying you, speak your mind. Tell your wife this thing that you have told me or this thing that you are doing, me pacho, come soon soon. So that ɛbɛkyɛ na mo mmienu sika a mosie no moatumi ayɛ dɛn atumi adi akyɛ mo mba no ɔmo nyi a moatumi enjoy nkwalaa no yie. And for the health service, let us try as much as possible to also create space for men consciously. Let us try as much as possible to reach men, engage men, so that at least they will say, so I said, Mama Caro can, consciously, if you're able to get them at where we can get them and also make time to also, screen, or let's say, omutimi show mapomudin ya, at least men and women, when they come together, the nation development actually, what should actually a Bwama or minor etumpom,
Yeah.
yes. So this is the small one that I can add before I
Thank
thank you
you.
very much for
Thank
also
you
having me.
so yes, thank you so much, Mr. Anaman. We are very grateful. Before Mama Caros comes in to give his last words, Albert, are you there?
Yes, sir.
Good. So, what happened in the service today? Give us some updates this week. The updates, the things that happen in the service.
Okay, good evening, everyone. So, this week, updates across our social media platforms, and then it's all about the Evidence Summit.
Mm,
The Ghana Health Service, through its research and development division, invites researchers and academics, health professionals, and institutions to submit abstracts to the 2026 National Health Research Dissemination Forum. So, basically, most of our post hovers around the Evidence Summit, and then the where to submit the abstract to is dissemination.research at ghs.gov.gh. So I take that again: dissemination.research at ghs.gov.gh.
oh,
So the submission deadline for the submitting of the abstract is Tuesday, 30th June 2026. Also, we had an incident, across social media platform. That was a missing child, like a missing baby incident in East Gunja. A missing baby in East Gunja. So the Savannah Region Health Directorate or the Ghana Health Service regrets to announce a unfortunate incident involving missing newborn at East Gunja District in Salaga on the 10th of June. So they are still on it, and I think these are what dominated. These are the updates that dominated our social media platforms for the week.
okay. Thank you very much. But I want Anaman. Are you there?
Yes, I'm there.
Good. Please, you are the lead for our evidence summit. Can you? I'm giving you 15 seconds. Please briefly touch on it for us so that we will all be aware of that.
All right, thank you very much. So the evidence summit, as Abed said, actually brings together researchers and practitioners to more or less like bring out what they have done. So in this case, this evidence summit is slated 5th to 6th August 2026. We have received about 53 abstracts that we are going to review and also accept some. So if you haven't submitted, try as much as possible. We will put the link. I think we have to share the link. I think right after here, please try as much as possible to put the link on the GoodLife platform so that if you have done something In fact, we want the interventional ones, not okay. We still want the academic research and then the scientific ones, but the interventional ones I think are the best that we actually want. So if you have done something within your community, try and then reach out to us. Let us show you how you are going to submit your abstracts, and then you assist you. So this year one, in fact, there will be a certificate, and then all the abstract will be put on the Ghana Health Service website as a reference document. If some people want to actually reference it when they are also embarking on some intervention. So let us try as much as possible to submit our abstracts. Thank you very much.
Thank you too, Mr. Anaman. K. Boatin, you are welcome. Alberta, you are welcome. Ifia Busu, you are also welcome. MDK, Mike, yes, you are all welcome. Try and share the live. Sammy Joe, thank you for sharing the live for us. We are grateful. If you just join us, this is the Good Life chat room of the Ghana Health Service, and we do this every Friday, 7 p.m. So next week we will be coming with we will talk about sickle cell. Next week, Friday is World Sickle Cell Day. So we will bring some experts to come and talk about sickle cell, to know about your genotype, who you should marry and what's not, and who you should stay away from. So don't miss it. Don't miss it. Make sure you come here next week and to have. But before we go, Joseph, Mama Caro, please give us your last
Yeah.
words. Your last. We wanted Auntie Sally to also come and advise the men to give us her perspective on the women's side, but it looks like her network is not favoring her. But Mama Caro, please give us your last words, your advice, what we should do.
All right. So what I would say at the end is that fine, you are an African man, your culture and your environmental values shape you to be the man you are. But when it comes to health issues, it doesn't care about your culture, it doesn't care about your gender. When you are handicapped or you are incapacitated as a result of poor health, all those things doesn't care again. We even have kings who die. But yeah, na yɛsɛ ɔmo mmara no wɔyɛ bɛrima nana yɛ bɛrima but nana tumi wu ne afei de yɛbɛka kyerɛ sɛ nana kɔ akura.
Mama
We
Carol,
need to be very very cautious
I'm
about
not cutting you. There was this funny video circulating. I think one of the kings, was it in a north or something, and he was just shooting, and he pointed.
esi odum kwa outside hɔ baabi.
Aha, you saw it.
Yeah, ɔtete tuo na ohun yɛ ase wɔ shoot ne ho.
Please continue.
Asɛm o, before yɛ bro. So so as I was saying, nana yɛ bɛrima nana yɛ bɛrima. Nana deɛ bɛma bɛrima adim ɛne sɛ nana asɔre a bosome mmiɛnsa biara wode kɔyɛ check up. Sɛ wode nso wayɛ busy a bosome mmiɛnsa biara kɔ. Yɛnkyɛke BP, yɛnkyɛke wasitiri. Nurses foɔ nso ba mo fie a mpatwɔ ma mo mpamo wɔn. When the nurses come around, monje na mo ne yɛni nkɔmmɔ. Yɛtiri bi kɔ a yɛmu bi ba na mmaa ne mmaa no bi ba deɛ mbɛyɛ wɔ wɔn koraa no tiri bi koraa nso yɛ asɛm o. Fɛ bi a taxi drivers no de bi wɔn si di ojo game, the girls ti kɔ de wɔn si di ojo wɔn. Ne nyinaa nso ka adwuma no bɛyɛ ne den. So we said that there should be moderation in what we take. We should reduce physical inactivity should be reduced. We should get engaging after eating. Aha, madam nyinaa ma se.
Thank you too.
Mesa o meeting foforɔ kɔ nti
Oh,
manka me ho a.
no problem. Thank you so much for coming. We are very grateful for showing up, and we hope you will join us again some other time. So thank you everyone for joining us this evening. This is a Good Life chat room of the Ghana Health Service, our TikTok live. We do this every Friday, 7 p.m. So next week is International Day, World Sickle Cell Day. So we will bring experts to come and talk about sickle cell. So if you want to know more about sickle cell, don't miss this episode. It's gonna be packed with more information and all. And tonight we spoke about men's health. Think that some of the health that men we take it for granted. We've spoken a lot. I'll be sharing a bit of them um, um, during the week. So if you miss it, you can go back and listen to it on your own time. But please don't miss next week one. Join early so that you can be part of the discussion. But before we go, men are often told to be strong, but real strength is not suffering in silence. Real strength is getting checked. Real strength is asking for help. Real strength is protecting your health before illness takes control. This men's week, please don't wait for pain to force you into the hospital. No, that's not a good thing. Know your numbers, go for screening, take care of yourself. It's very important because the strongest men are the ones who choose health. Thank you for joining us this evening on the Good Life chat room. Follow us on all our social media handles at Ghana Health Service and Good Life GH. And until next time, which is next week, this has been Good Life chat room. Good life, live it well. Um, good life, it's an everyday thing. Bye bye.